Welcome to Family Health by Mini First Aid. Mini First Aid are the UK's leading family first aid provider, and we are delighted to bring our latest podcast series to you, giving you all the information that you need around family health subjects. Thanks for joining. The Family Health Podcast is brought to you in partnership with Things Happen, a trusted financial advisor that supports new parents and their families. Things Happen offer the best advice to help parents and their families make informed financial decisions, ensuring a secure and tax-efficient future for their children. The team at Things Happen are highly qualified financial experts who will guide you through the different types of policies to consider as your family expands, taking the stress out of decision-making by finding the best deals for your needs, ensuring you and your family are protected no matter how busy life gets. If you already have life insurance, Things Happen will carefully review your existing policy to ensure that it still meets your family's evolving needs, so you know your family is fully protected. Hello and welcome. My name is Kate. I am the founder of Mini First Aid and I'm your host for today's podcast, Family Health by Mini First Aid. I'm absolutely delighted that you've taken the time to listen to our podcast. Whether you're in the car, you're cleaning, or perhaps you're relaxing with a lovely cup of tea, our Family Health podcast covers all the topics that might affect your family members. And if you've ever got a family health concern and are thinking, I'm going to Google that, then have a listen to us instead, and we have the answers that you need. We have a wealth of guests through the Family Health podcast library, and today I'm thrilled to announce our guest this week, Olivia Boden, body image coach, and Jenny Penkel, a counsellor and psychotherapist. Olivia and Jenny are going to discuss body dysmorphic disorder, or also known as body dysmorphia, or BDD. Now, I thoroughly recommend that you listen really hard to this podcast today. It's going to cover an image that perhaps for some parents and carers, they had not considered before. So ladies, welcome. Thank you for coming to talk to us today. Tell us a little bit about yourselves.
Thank you, Kate.
Jenny, do you want to go first?
Yeah, okay, thank you. So I was an anxious child and teenager. And during my teenage years, I had something of a dance with body dysmorphia. I was a compulsive skin picker, and I'd inherited that from my father. And I subsequently kind of recovered from my body image issues in my early 20s. And when I had my first child, I had postnatal depression, and my son grew to develop body dysmorphia, anxiety followed by body dysmorphia. And by that time, I was trained as a therapist, but I had no concept of what this meant really, or how to deal with it. And we went through many different forms of therapies over maybe 15 years. Trying to find the right help for him. And over the time that he was suffering with that, I learnt. And he eventually emerged from it, from body dysmorphia, and trained to be a therapist himself. So he's now also a psychotherapist working. And so we work together and with families where there's body image issues. I think that might be enough from me for now.
Oh, brilliant. Thank you, Jenny. That's really fascinating to hear your history. Olivia, tell us a little bit about yourself.
Yeah, so Olivia Boden, coach and founder of bodyimagecoach.co.uk for teenagers going through eating disorders and body dysmorphic disorder. Author of several self-help books, including a title, I Hate the Way I Look, and founder of Dear Heart Column, which is a free self-help platform available to everybody. And just sort of following on Jenny's lovely introduction, is the same or similar reason why I got into this work as well, just because of my own personal experience of BDD and having an eating disorder as well.
Thank you, Olivia. Jenny and Olivia, welcome. And there might be people listening, and in fact for many, that might not have heard of body dysmorphia before. Ladies, can you tell us a little bit about it? Explain it to us.
In a nutshell, is that what you want?
Yes, we like in a nutshell. Our listeners like in a nutshell, because people can be fascinated on a subject, but when you say to them, do you actually know exactly what it is? And people say, oh, I don't know. So yes, tell us. Yeah. Tell us what body dysmorphia is.
We'll try our best. Body dysmorphic disorder, also known as BDD, is a mental health condition characterised by a preoccupation with perceived flaws or defects in one's appearance, which are often minor or imagined. So individuals with BDD become excessively focused on certain aspects of their appearance, believing that these flaws make them unattractive or deformed, despite reassurance from others that the flaws are minimal or non-existent. So spending a significant amount of time each day obsessing over their perceived flaws, or often engaging in repetitive behaviours such as mirror checking, comparing themselves to others, or seeking reassurance about their appearance from others, avoiding social situations or work or school due to feeling embarrassment or shame about their appearance, leading to isolation as well. Engaging in avoidance behaviours such as wearing excessive makeup or clothing to hide perceived flaws, seeking cosmetic surgeries or ways to fix their appearance, or withdrawing from social interactions altogether. So lots of different symptoms forms BDD, and it's different from self-loathing because the rule of thumb really is that if you obsess for more than an hour a day about your looks, then you may have BDD, although this is not foolproof analysis, but it is something that GPs and other practices do use as a measuring stick. But yeah, so that's kind of in a nutshell what it is.
Sure. So that hour of worry, because I was going to ask you then actually about teens, and we know not all teens, but a lot of teens worry about their appearance. And we have all sorts of drivers in social media and TikTok and workplaces where teens can see what they perceive perhaps to be perfect bodies and images and computer generated, all sorts of scary things that us parents dread and loathe and wish that our children didn't have to experience. But there is a tipping point, isn't there, between a child or a teen having some criticism of or worry about their appearance to this obsession, and that's that 1 hour marker or thereabouts. Is that what you're saying, Olivia, for making it as BDD being more than a worry?
Yeah, I think for me the measuring stick that I use would be looking at all of the thought processes and the behaviours and the habits, and see how much of the time is consumed with all of it and how much it impacts the life as well. But the 1 hour thing that I mentioned before is something that other therapists and people in the NHS use as well. So, but yeah, it's more complex than that. I think it's not one shoe fits all kind of thing.
Okay, and we're going to delve into that more as we have our conversations today. But can anyone have BDD? Is it certain ages? Is it males? Is it females, men, women? What do we know about BDD? Can it affect everybody?
I think although it's presented more in females, it's important to recognise that the disorder can affect individuals of any gender and any age. And we need to look at the cultural factors that emphasise more importance on beauty standards procedures, where we see in the media, so, things like filters and product marketing to achieve a certain look. BDD typically begins in adolescence or early adulthood and tends to be chronic if it's not treated. So some symptoms of, for someone with BDD wax and wane over time with periods of remission followed by a relapse. And there may be reasons why someone may develop BDD. For example, BDD is shown to be higher in those that have ADHD or autism, right. Which is something that I was diagnosed with ADHD only 2 years ago, which was a bit of a shock to me, but
Right.
actually makes total sense now. So is that why I developed BDD and an eating disorder at a young age? I'm not sure, but there's a higher chance. So there's all sorts of different characteristics and reasons why people might develop BDD, but it is something that anybody can get. And everyday stress, someone that's going through stress on a everyday, it's a way of finding a way to cope with everyday stress. So as well as that, there's cultural norms and values related to beauty, appearance, body image. These are across different socioeconomic areas, and in some cultures there may be greater emphasis placed on physical appearance, so leading to an increase in pressure to conform to idealised standards of beauty.
Right.
So in answer to your question, yes, anybody can develop BDD, at any time.
But there can be some area. And do we know, for body dysmorphia, do we know why some people develop it and some don't? You know, how do some people react to that stimulus of having to conform to a perceived norm or beauty requirement, and some don't? So some manage to avoid it.
We're not sure.
Okay.
There are multiple factors, as Olivia has just said. I personally, in my experiences working as a therapist with people who have body dysmorphia, I usually trace with them their timeline, their history.
Right.
And quite often we will find trauma and relational trauma. And trauma is a word that we have to be really careful about, because when we talk about trauma, we think about a big event, something big and terrible. But actually, with something like body dysmorphia, it can equally be the drip effect of maybe a parent that undermines one's self-esteem, or an underlying sort of current of attitudes towards image in the household, or another drip would be bullying in school. But we also believe that there is a genetic and an epigenetic factor in how people are likely to develop or to have BDD come into their lives.
Right.
So it's multifactorial.
Right. Well, that's fascinating. Do we know whether body dysmorphia can also lead to other mental health problems or be linked to other mental health problems?
Yeah, so due to significant distress and impairment that it causes in an individual's life, some of the other common mental health issues may occur with BDD. That could be things like depression, anxiety, OCD, and actually I can relate to the OCD because within BDD there is an element of OCD, so you're compulsively checking your body parts or skin, or and it's that repeatedly doing something over and over again. But also there's panic disorder, social anxiety. It's not an exhaustive list, and some people also develop BDD with personality disorder. So, and as I mentioned earlier, there's learning difficulties as well. So the list is quite endless, really. Usually there's a comorbidity within, if someone has one mental health disorder, they may have another one as well. So, yeah.
Right. Okay. And now, Olivia, you have experienced BDD yourself, you said in your introduction. Are you happy to share your story with us?
Yeah. So actually, from the age of 4, my first thought was of my right knee. I was running up a hill in the park, and I remember thinking that my knee doesn't look right, and then covering it up where possible. And it's weird because I don't remember much of my earlier days. I didn't have the best upbringing, but I remember being very conscious of my knee at that time. So I certainly had the awareness of looking at my own body and not liking it. And that manifested into other parts of my body. And by the time I reached an adolescent, I was undiagnosed with BDD. So I wasn't aware what I was doing, and it wasn't diagnosed. But I kept it a huge secret, so nobody knew about it. I didn't have anybody to talk to about it. And the reason I did it, looking back, was because I felt unloved and unacceptable, and I had out of control feelings about myself. So it was a very dark path that lasted way too long, up to my 30s, in fact. And by then it was deeply rooted into my soul. It felt like, I just felt like I was not acceptable to others and that I looked too ugly for love. Which sounds like a book, doesn't it? Like Too Ugly for Love. And it sounds quite, when I say it now, it feels like I wasn't that person. It doesn't feel like it belongs to me anymore, but that's because I've done a lot of inner work on it. And that's because I don't have that, that fear anymore. But I really struggled in relationships, and especially romantic ones. So, but thankfully, the few people that I did date were so self-absorbed that they didn't notice what was going on with me.
Right.
So, there's a silver lining everywhere, isn't there?
Yeah.
I was very good at hiding my feelings. So I went through early life like piling up on the makeup, having boob surgery that went wrong, sleeping with makeup on and reapplying makeup before my partner would wake up so that he would never see me without makeup, pulling my hair in a tight ponytail so that my face looked more acceptable. And I just had all of these coping strategies, and I was entrenched in things to help me feel better. And it did get me through to a point, but then there was a time when I felt suicidal about wanting to, basically I felt suicidal because every time I looked at my hands, I was having a panic attack. So I was having about 7-8 panic attacks a day. And basically I just wanted to chop my hands off so that I wasn't having a panic attack anymore. And I remember thinking about how life would be if I didn't have hands anymore. And I know it would be difficult, but at least I wouldn't have a panic attack anymore, and I wouldn't be able to look at my hands, and that would stop the panic attack. So it becomes very distorted and very, very dark. And to be honest, sorry.
No, I was going to ask you, Olivia, and you might not be able to draw on this memory or want to, but what were you seeing in your hands that made you not want your own hands?
Yeah, I just felt like I had old lady hands,
Right.
hands of a 90-year-old. And bearing in mind, this is when I was in my from 18 plus. I just became very obsessed with my hands, which had manifested from other parts of my body and skin. Mine was all to do with my skin. Right. And so the older I started to get, the more I started to obsess, and it just manifested into other parts of my body. And the hands I think because your hands are in front of you all of the time, it's hard not to see them. And every time I looked at them, it was reinforcing the thought process in my mind saying, your hands look old, like covered, you need to cover them up. Don't let anybody see them. They're hideous. They just look like 90-year-old hands. And yeah, that's pretty much how it went. And, when you get to that stage where you're thinking about chopping off your hands rather than having two perfectly normal hands, that's when you know that there's a real problem there, isn't there? It's not good. And so I did, it's funny actually, because it wasn't the support that I received so much, but the knowledge that I accumulated in order to heal. And I think there's something to be said about knowledge equals power, because once I had knowledge of how BDD and how the brain works, it was a great stepping stone for me to healing. I did go through the NHS for help. Again, bearing in mind, this was 30 odd years ago. So to be honest, the NHS didn't know what to do with me because I don't think BDD was well recognised. And even now it's not that well recognised. But what I did was I immersed myself into long and painful meditation retreats that forced me to look at myself inwards.
Right.
And that was the beginning of healing for me. And that's where, from there, I studied the psychology and mental health and realised what I was doing to myself. And then I studied the counselling and coaching so that I could help others. And actually, that's where I met Jenny on a lovely Vipassana meditation retreat. So we both did that painful but needed process of looking inwards.
Olivia, you've just taken everybody that's listening, who's now probably breathing because they were all holding their breath through your story, because of that real feeling that when you started talking about being a little girl and wanting to cover up your knee, through to wanting to cut off your hands because you didn't like the look of them. Just, you've been on an incredible journey, and the fact that you've been able to do that inward looking, and we're going to talk more in a minute about how we can spot signs and symptoms and how we can support parents who suspect that their children may have body dysmorphia or an issue with body image. Jenny, is there anything that you would like to add to Olivia's personal story there? Is there any experience that you're happy to share or would like to add to that story?
I think that body dysmorphia creeps up on us.
Right.
It's a very insidious thing. And as a parent, I had no concept what was happening. For me, it was just, this is anxiety. In fact, it was even hard to see what was going on in my son's world for how bad it really was. I think when you're a parent, you tend to be on that journey of getting the children up, doing the things that you do, and just taking yourselves through the days and the weeks, and perhaps not slowing down and seeing actually what's happening, and the impact of things like bullying and miscommunications. I wish I'd known more. I wish I'd educated myself more. But back then, and I'm talking a long while ago, my son's now 38.
Right.
But back then there was I don't think I'd have been able to find the information about body dysmorphia. So it's wonderful that it's opened up. And I think the fascinating thing was that back then, and even relatively recently, from the onset of body dysmorphia to diagnosis used to be 15 years.
Wow.
Yes. So, for example, if you have OCD, it's quite visible because there'll be lots of OCD behaviours going on. With body dysmorphia, that diagnosis time is a real representation of the internalization of the suffering of the individual and to some extent of the family. Because as a family, it's very easy to think this will go away. I remember thinking it was the summer holidays, it's the start of the summer holidays, and it had been very difficult for my son in the lead up to the GCSEs because of his anxiety, and what I didn't yet know was body dysmorphia. And I remember just going off on this holiday, flying away to a beautiful place with my 2 children and my husband, and thinking the exams are out of the way. We've got 6 weeks off of peace. And I remember that sinking feeling of realizing we hadn't left it behind. And I was devastated. And it didn't go away. So that would be an important thing, I think, although we might speak about this later. It's be aware, educate yourself. I have a list, if you don't mind, Kate.
Of course,
a list of things to watch out for.
And this is, I was going to say, so parents are going, okay, so what do I need to look for? What's the spot? Share your list.
Well,
that's so helpful.
This is not an exclusive list.
Yeah.
Okay. And I didn't prepare for today. I wanted to just freewheel through this conversation. So I've been scribbling notes down while Olivia's been talking and firing off what she said, but I'll try and make this as precise as possible. What we're going to look out for is that intuition, my child's struggling. And I think I would say to any parent whose child is struggling psychologically, just have that question, could this be body dysmorphia?
Okay.
We don't want body dysmorphia to be left brewing, because sadly once it becomes a severe and enduring problem that's been in place for 3 years or so, it becomes incredibly difficult to treat.
Right.
So we're looking out for some of the following. And if you want me to say more about them, I'm just going to use them as bullet
no, great.
points.
No, that's helpful.
Okay. So, visible preoccupation with a feature or their body. And that can be things, I think it's important to note that can be with a real issue. So it might be that they have a scar or a mole, and that's a real, it's tangible. You can see it, they can see it. Or it might be something that is actually your child is saying, look, I've got this bump on the side of my nose, and it would be very easy to dismiss that and completely just go, no, because you haven't, At that point, I think we need to be really careful that we don't completely dismiss it. We hold it in mind as do I need to be mindful of this actually being something that my child is trying to tell me? So our responses to the possibility of this are really important. We'd be looking out for withdrawal. Our child doesn't want to go to school, he doesn't want to socialise. Looking out for all forms of emotional distress. So sometimes people who have body image issues, there is no visible sign of the kind of behaviours that we might initially expect. In fact, the young person might display anger, or what perhaps we might say is acting out behaviours, just very difficult. That I don't want to go to school. Well, if they have body dysmorphia and they don't know that they've got body dysmorphia, because they won't know they've got body dysmorphia, that's the whole thing with it. They won't want to go to school because they feel so horrendous about themselves. It's such a dangerous thing to do, to be seen. So you might have tremendous battles about getting them out of the door to school, which become a whole different thing. And you start to think, I've got a school refuser here. We might be fined. But in fact, the heart of the matter is that it might be body dysmorphia.
Right.
Reassurance seeking is a huge topic, and I think it's really underspoken of because it carries so much shame within a family. Concealment. Reassurance seeking can take over the life of a person who has body dysmorphia. Olivia kept her body dysmorphia as a private process. I don't know statistics about how many people go into the private world of body dysmorphia and how many people it becomes visible and very demanding. But learning about reassurance seeking and just witnessing whether you are maybe becoming embroiled or involved in your child or your young person speaking a lot about their distress and wanting reassurance from you.
Okay.
That's a real giveaway. Anger. They may be angry. Older children may get involved in drowning their anxiety, because body dysmorphia is an anxiety disorder, in drugs and alcohol or other behaviours. Camouflaging themselves, hiding away. So hair covering the face, excessive makeup. Now that's such a sensitive one, because if you're a teenage girl, you're
wearing a lot of makeup.
Excessive makeup.
Yeah.
But you kind of just monitor that.
Okay.
Is that really a cause of a panic attack if they're seen without their makeup?
Right. Okay.
That kind of thing. Be aware that the focus of BDD can shift, and as Olivia has said, one month it might be my nose, it might be my teeth, it might be any part of my body. Generally, having a debilitating, deeply troubling perspective about their appearance.
Okay.
And that's if they're displaying it. So you have these two parts.
Sure. Okay.
Yeah. I hope that covers some.
Yeah, no, it does.
But there's
I'm sure.
vast array.
I'm sure, and I think what we'll do as part of the podcast, because we only have a sort of a short period of time to chat to each other. So I think it's important in our signposting, which we'll do in the podcast notes, that there are resources that parents can go to read more and to understand more about some of the signs and symptoms. I just want to ask about getting further help. So if you suspect that your child has body dysmorphia or has concerns about their body image, who do you talk to? Is it your GP? Is that where your first port of call is? Where do you go?
I would say first, observe.
Okay.
So observe your child for a short period of time and educate yourself as much as you can about what might be going on. Because even today, GPs may be under-resourced. They are under-resourced. And a 10-minute consultation with your GP is going to be, you're going to have to go in with the facts, and be able to present it to get the support that you need.
Great.
So yes, I think the GP is the first port of call. Alternatively, finding a therapist or finding a therapist. We could get into all kinds of conversations about medication for young people. There is no evidence that drugs for BDD for under 18s are safe.
Okay. So I guess from a perspective of this podcast is we would have to ask or suggest to parents that they need to take more advice and to understand
Absolutely.
and make sure that they're fully informed. Now, you both work with young people with BDD. What sort of techniques do you use in your programs, or can share just a couple of things with us that will help young people to recover from this condition? Is it possible to recover from this condition, or is this something that they have to live with?
Yeah, so it is possible to recover, and the two main techniques that I use are positive intelligence coaching and elements of internal family systems. So what I do is I help the client to get in touch with their inner critique, which we call the judge, and we all have one. And it's with us our whole life, and sometimes it's very loud, and sometimes it's very quiet. So we do some very deep work with the inner judge, and there's a program on Body Image Coach on our website that helps the client to go through the 4 stages of healing. And so what I do is when I go through the 4 stages of healing with the client, it's really nice to see them become aware of their thoughts. So the first stage of the 4 stages of awareness is what I call a zombie stage. And that's where you are living in this world of BDD, but you're not even realizing what you're doing, what you're saying to yourself, or what behaviors that you're partaking in.
Okay.
And then all of a sudden you go through the program, it really shines light on everything. And then you realize, what have I been doing to myself? So then you reach the second stage, and that can be a real awakening for a lot of clients. And it can be quite upsetting as well, because when you realize what you've been doing to yourself, it's great, but it's also very sad, that you turn in the corner and realizing what's been going on. And then you go to the second stage, which is the awareness stage, which is becoming aware of everything, being the guard of your thoughts rather than the zombie of your thoughts. And then the third stage, which is the practicing everything within the program that we've taught them and gone through with them. And then you reach the 4th stage, which is mastery. And when we go through this with clients, they really like that there's only 4 stages, and they like that they'll never be at the first stage again, ever, because once we've discovered the 4 stages, they've usually gone through they've gone past the zombie stage.
Yeah, okay.
So they'll never get to that first stage again. And so in their mind, there's only 3 stages to go. So it can't be that hard, right? And it is difficult, but it's not impossible. But you've got to put in the work. And that's what we do with them. We put in the work. And if it gets to the point where my coaching is not enough, then Jenny and Adam, who's also on the team at Body Image Coach, then I would refer them to Jenny or Adam, and they would do, start the therapy with them. So, but whatever process they find, there is help out there.
Great. Hugely reassuring. And I think I didn't, and I'll confess, ladies, I didn't know a huge amount about this subject area at all. I'd heard of the phrase, but now I feel I have a better understanding, and I feel like we've just sort of scratched the surface, really, for want of a better phrase, because I think there's so much more. So we will signpost our listeners to more information from you, but we always ask at this point in our podcast, if people have been listening and you want them to have one takeaway on BDD, body dysmorphia, what would you want that to be?
Do you want me to go first, Jenny? Or okay, so BDD is not about vanity. So please don't think that it is about vanity. It's about it's a feeling of not fitting in. It's about wanting to feel loved, and it's about wanting to be part of the community. It's about wanting to feel safe, because ultimately the reason a lot of people develop BDD is because they don't feel safe in their own body, in their own skin. So it's a sign to us that a person is needing more than what they're currently receiving, however that may look. And BDD is also not the fault of another. So if you're a parent and you have a child that's struggling, it's not your fault. But also BDD is curable, and there is help out there, and that's what we do. And, we've seen people come away from it. I've come away from it, and it is curable. So there is help and there's hope.
Thank you, Olivia. How about you, Jenny? What would you want parents or carers take home to be?
I just want to say that my work tends to be with adults who have body dysmorphia and supporting parents and families. And so it's a slightly different perspective from Olivia. I think this is a hard one, but I think I would want to say to parents who may be listening, look to yourself and see if you can make a change in the dynamics in your family, and really protect your child, perhaps in ways that you hadn't considered doing before. And that I am aware that I don't mean to put a burden of responsibility onto parents, but I wish somebody had supported me better to understand what was going on in our house so that it didn't escalate, and there was no support such as that.
Jenny, that's really helpful, and I'm sure that will leave us with lots to think about. Guys, thank you so much for coming and sharing both your personal experiences but also your professional expertise today with us. It's been a really interesting listen for everybody, I am sure. Folks, you've been listening to Family Health Podcast by Mini First Aid. Thank you for joining us today. Don't forget to subscribe to the podcast, because it means that each episode will drop in on your regular podcast platform. You can also follow at Mini First Aid on socials, which will mean that you have access to a newsletter that you can sign up to, which gives you regular health and first aid advice, and will also tell you when the next podcast is coming out. And don't forget, if you have a particular subject area that you would be really interested to listen to, please let us know, because it's really important that we deliver to you the family health subjects that you most want to hear about. So you've been listening to Family Health by Mini First Aid. Thank you for joining us today. Thank you for listening to Family Health by Mini First Aid. I hope you found our podcast really useful and informative. If you want to know more about Mini First Aid classes, courses, qualification courses or first aid supplies, please do visit minifirstaid.co.uk or look us up on all your favourite social platforms at Mini First Aid. And just a little reminder from me and our sponsor, Things Happen, that if reviewing your life insurance is still on your to-do list, take time to get in touch with a Things Happen advisor today.